Antibiotic resistance is one of the greatest threats to humanity. For more than 80 years, antibiotics are used to treat bacterial infections in humans and animals successfully. But when antibiotics are administered, bacteria can also develop resistance. This limits treatment effectiveness and may also result in treatment failure. A conservative estimate concluded that more than 500,000 people in Europe are infected with resistant bacteria every year, with more than 30,000 dying. The general scientific opinion is that the situation is getting worse and that urgent action is needed. In Germany, the BWL is the competent authority for the authorization of antibiotics, both for food-producing and companion animals. Antibiotic resistance is not a national but a global problem, so we cooperate intensively with other authorities and institutions across Europe and worldwide. In addition to the monitoring of sales and use data for antibiotics, we also monitor bacterial resistance. And we propose measures to combat resistant bacteria spreading via animals. We advise the statutory bodies, and we are also in close contact with veterinarians, animal owners, the industry, and the public. We follow the so-called One Health approach, recognizing human health, animal health, and the environment. We assess how these factors interact and influence each other. All those working in the human, veterinary, and environmental sector must work closely together. We need a better understanding of the link between the use of antibiotics, the emerging of resistance, and the spread. We need to preserve treatments without antibiotics for animals and humans. At the same time, we need to promote the development of new antibiotics for human medicine. In general, we need to raise awareness of this problem among doctors, vets, and farmers, but also among patients and pet owners. Prudent use of antibiotics must be our goal to preserve antibiotics as effective weapons against infectious diseases for future generations. Only if we work closely together and if we use antibiotics sparingly and responsibly, we have a chance of winning the fight against antibiotic resistance.